everyone, and welcome back for another deep dive with us.
Glad to be back.
Today, we're going to be wading into something that's pretty close to home for a lot of us, I think, and that's heart failure.
Yep.
Um, and specifically, how to make sure that you or your loved ones are getting the absolute best care when heart failure, throws a curveball.
And trust me, this isn't just about medical jargon. We're talking about this. We're talking about real people facing a really, really tough condition. And this recent review from JCC, the Journals of the American College of Cardiology, really brings that human element of this to the forefront.
Okay, so before we even get into the nitty-gritty of treatments and things like that, set the stage for us a little bit. How big of a deal is heart failure these days? Give us the reality check.
It's a big deal. 56 million people worldwide are living with heart failure. That's like the entire population of some countries.
Right.
And think about it. A lot of these folks are our parents, our grandparents, maybe even ourselves down the line. So
Yeah.
it's not just statistics. It's deeply personal.
Yeah, that's a lot of people. Okay, so we know it's common, especially as we get older, it sounds like.
Yeah.
But what about the stakes? What about when things, really start to become a problem? The review mentioned something about hospital visits being a turning point. What did they mean by that?
Right. So unfortunately, heart failure hospitalizations, they come with a pretty sobering 17% in-hospital mortality risk.
Oh, wow.
And the readmission rates are really high. Hold on to your hats here, 25% at 30 days, and then a whopping 36% within 90 days. It's a revolving door for a lot of folks.
So not just a blip on the radar, this is a potentially life-altering event, it sounds like. But you said turning point, and I kind of want to go back to that. Is that just about the risks, or is there sort of an upside here too?
There is an upside. While it's a scary thing, this review really emphasizes that hospitalization is also a chance to kind of hit the reset button on how we're managing heart failure.
Okay, I like the sound of that. So what does hitting reset actually look like? What should patients and families be asking about when this happens?
That's a great question. Decongestion is a big one. Basically getting rid of all that excess fluid buildup that makes heart failure so rough.
Right, so less fluid, less work for the heart to do.
Exactly. And it's not just about comfort either. It's tied to those readmissions and even survival rates. If someone's still congested when they leave the hospital, the odds of them bouncing right back, or worse, are just way higher.
Yeah, that makes sense. So rapid decongestion is key here. What's the usual game plan for that? How do they make that happen?
Well, loop diuretics are the heavy hitters here, so to speak. They help your body flush out that extra fluid.
Okay, and I think I've heard that our bodies can almost become resistant to those over time. What happens then?
Yeah, that's a really common problem, especially as heart failure progresses. One study, Transform-HF, compared two popular loop diuretics, torsemide and furosemide. And you know what? They found that they were pretty similar in terms of preventing death. So neither is inherently better. It's about finding what works for you.
So if those aren't cutting it, what else do doctors try?
Well, that's where something called sequential nephron blockade comes in.
Oh!
I know it's a mouthful.
Yeah.
But think of it like this. Different diuretics, they work on different parts of your kidneys.
Right.
So this approach combines them to target fluid removal from, multiple angles.
A multi-pronged attack on fluid overload. I like it. So what does the research say about how well that works?
Well, there are trade-offs. One study, chlorotic, found that adding hydrochlorothiazide, another type of diuretic, to intravenous furosemide did help people lose weight quickly, and by that we mean fluid loss.
Okay, well, that's good. Yeah.
But there's always a but, right?
Yeah.
It also led to worse kidney function for some people.
Mm.
So it's a balancing act for sure. Effective in the short term, but we need to keep an eye on those long-term effects.
Man, it's never simple, is it? Always weighing those risks and benefits. What about other combo strategies for that sequential approach? What's new there?
Well, the ADVOR trial, that looked at adding acetazolamide.
Yeah.
Yet another type of diuretic.
Yeah.
And the good news is that it led to faster decongestion, shorter hospital stays, which of course everybody wants.
Yeah, shorter stays, less hospital food, right? I'm kidding, mostly. But, okay, so is that it, or are there, longer-term wins, too?
That's the thing. We don't know yet.
Yeah.
There's no evidence that it helps people live longer or have fewer issues down the line. So promising, but more research is definitely needed, which, by the way, is something you'll hear us say a lot in this field.
Always more to learn, it's true. Speaking of which, I keep hearing about these SGLT2 inhibitors for heart failure. They seem to be all the rage these days. Do they play a role in this whole decongestion puzzle?
Oh, absolutely. They were first developed for type 2 diabetes, but man, have they shaken things up for heart failure too. And yes, decongestion is part of their superpower.
Okay, I need details. What's the evidence?
The Impulsi trial, this was a game changer. It found that empagliflozin, one of these SGLT2 inhibitors, not only helped people overall, like living longer, healthier lives, but it also significantly improved decongestion across the board. That's a win-win you don't see every day.
That's huge. Okay, so we've got these like powerful diuretics, combination therapies, even diabetes meds are stepping in now. Are there any treatments that have been tried for this that just like didn't pan out?
You're right to ask that because not everything works as hoped, right? Dopamine, serotype, ultrafiltration, they've all been studied extensively. And unfortunately, they haven't been shown to reduce deaths or those repeat hospital visits that we talked about.
Yeah.
But science is about testing, and sometimes those tests show us what not to do, which is just as valuable.
Totally. Yeah, it's about getting the full picture. No, I do want to touch on one more thing I've heard about, and those are pulmonary artery catheters or like PA catheters.
Hmm.
Should those be used to guide decongestion?
The PA catheter debate, a classic.
Right.
So the ESCAPE trial, a really big study, found that using it to guide treatment didn't actually improve outcomes compared to just good old clinical judgment. In fact, it was even linked to more problems during the hospital stay.
Oh, wow. So case closed, no need for those catheters.
Well, not so fast. The ESCAPE trial did have some limitations. For example, it didn't include folks on inotropes, those meds that help your heart pump stronger. So there might be specific cases where it's helpful. Like we said, it's always about individual needs and talking to your doctor.
Right. One size does not fit all in these situations. Okay, so we've covered a lot of ground just on getting rid of fluid. But what about medications that can actually help the heart long term? I think you called them the four pillars earlier.
You've got a great memory. And that's a perfect segue into the next part of our deep dive. We're about to explore those four pillars: beta blockers, ARNI or RAAC, MRS, and yes, our new friends, the SGLT2 inhibitors, and how they come into play even when someone's hospitalized with worsening heart failure.
Don't go anywhere, folks. We're just getting started. All right, so we are back, and we are diving headfirst into these four pillars of long-term heart failure treatment. It's one thing to like manage the symptoms in the moment, but what about megs that can really, truly change the game down the road?
Yeah, that's what's so fascinating about these four classes of medications. We
Mm.
call it guideline-directed medical therapy, or GDMT for short. And the research shows it can be incredibly powerful, even when someone's hospitalized with worsening heart failure.
So not just like preventing things from getting worse, but like actually helping to turn the tide during a crisis. That's reassuring to know. But before we get into specifics, remind us again about these four pillars.
Of course. So we've got beta blockers, which help slow down the heart rate and ease the heart's workload. Then there are the ARNIs, a newer type of drug that actually combine two mechanisms in one pill to relax blood vessels and reduce strain on the heart.
Two for one deal. I like it. What about the RACs I've heard about?
Yes, those are an older but still very effective class of drug that also help relax those blood vessels and reduce fluid buildup. Similar to ARNIs, they're like the tried and true veterans of heart failure treatment.
Right. Okay, so that's beta blockers, ARNI, or RAAC. What are the other two?
Right, so then we've got MRAs, which block the effects of a hormone called aldosterone. That can contribute to both fluid retention and heart damage. And lastly, we can't forget about our new favorite, the SGLT2 inhibitors, which, as we discussed earlier, are showing remarkable promise in improving outcomes and helping with decongestion.
Right, the overachievers. So you mentioned these medications have like really proven themselves even in worsening heart failure, but what does that actually look like? Give us some concrete examples.
Sure, so take the Pioneer HF trial, for instance. It showed that the RNI sacubitril valsartan was more effective at lowering levels of a key heart failure biomarker called NT-proBNP than enalapril, an ACE inhibitor, in patients hospitalized with acute heart failure.
Okay, so less of that bad biomarker floating around. That's a good sign.
Exactly. It means the medication is doing its job in protecting the heart. And then there's the RNS trial, which demonstrated that spironolactone, an MRA, could actually reduce the risk of death from any cause in patients with severe heart failure.
Wow, actually reducing the risk of death? That's incredible. These medications sound like real game changers. But, and I gotta ask, don't they also have a bit of a reputation for side effects?
They can, and that's often a barrier to people taking them as prescribed. But the thing is, a lot of those fears are based on outdated information or misunderstandings. For instance, there's a common misconception that these drugs are bad for your kidneys.
Yeah, that's something I've heard too. What's the truth about that?
The reality is these medications can actually be beneficial for kidney function, even in those with heart failure. The latest KDI-GO guidelines, which are developed by kidney experts, support their use in many patients with existing kidney issues.
So again, not a one-size-fits-all situation. It really comes down to that individualized care and having those open conversations with your doctor. What about hyperkalemia, though? That's another side effect I've heard a lot about, particularly with RAACs and MRAs.
You're right, that's a valid concern. But this review outlines some really clear and practical steps for managing it. Monitoring potassium levels closely is key, obviously, using potassium binders if needed, and only adjusting the medication dose as kind of a last resort.
So not an immediate deal breaker. There are ways to manage those risks. What about hypotension or low blood pressure? Another one that pops up, right?
Absolutely. Again, there are ways to minimize the risk. The review suggests discontinuing any unnecessary medications that might be contributing, staggering doses of beta blockers and RACs, or considering alternative meds if needed. But even those who experience hypotension, GDMT can still provide benefits.
Okay, so we've talked about potential kidney issues, hyperkalemia, hypotension. Anything else people should be aware of with these medications?
Well, with SGLT2 inhibitors, there is a small risk of a condition called diabetic ketoacidosis, or DKA, and a slight increase in the risk of genital infections.
Whoa, okay, those sound serious. How worried should people be about those?
Well, it's definitely important to be aware of them. These side effects are relatively rare and usually manageable with proper care. For DKA, the review emphasizes that temporarily stopping the SGLT2 inhibitor during, severe illness or dehydration, and immediately stopping it if DKA occurs can dramatically reduce the risk. And for genital infections, simple hygiene measures and prompt treatment with antifungal medication are usually all that's needed.
Okay, so manageable risks, but definitely something to discuss with your doctor. Now, I know we keep saying, talk to your doctor, talk to your doctor. But what about those listening who might be thinking, this all sounds great, but I'm older. Are these medications even safe for me?
That's such an important point. The reality is older adults are actually the most likely to benefit from these medications because they're at the highest risk of complications from heart failure. And a key takeaway from this review is that frailty or age should not be a barrier to receiving potentially life-saving treatment.
That's a really, really powerful message. I do want to push back a little bit here, though. We know older adults are often on multiple medications already, and adding more to the mix can feel overwhelming, not to mention the cost. How do we address those concerns?
You're absolutely right. Polypharmacy and cost are huge issues. But there are ways to make these medications more accessible and manageable. Generic options are often available, and some pills can be split to lower costs. Plus, initiatives like Cost Plus Drugs aim to make medications more affordable by cutting out those unnecessary markups. And when it comes to juggling multiple medications, a good pharmacist can be an incredible resource. They can help you stay organized and make sure all your meds are playing nicely together.
Great points. Okay, so we've got our 4 pillars of GDMT covered. We've addressed some common concerns that people might have about taking them. But medication isn't the only tool in the toolbox, right? What about other treatment options like devices or support systems?
You're thinking like a true heart health detective. You're absolutely right. There's a whole world of therapies beyond pills, and they're incredibly important too. And that, my friend, brings us perfectly to the next chapter of our deep dive. We'll be exploring those options, from cardiac resynchronization therapy to the power of palliative care.
Stay tuned, folks, because we are just getting started. We are back and ready to explore those treatment options beyond medication, the gadgets and the support systems that can make a real difference in managing heart failure. What's first on the list?
Let's talk about cardiac resynchronization therapy, or CRT for short.
CRT, that rings a bell. But for those of us who don't speak cardiologist, break it down for us. What exactly does CRT do?
So imagine your heart as an orchestra. For it to work properly, all of the different chambers need to be beating in sync.
Okay.
Well, in some people with heart failure, those chambers, they get out of whack, and their rhythm is off. That's where CRT steps in. It's essentially a special kind of pacemaker that helps resynchronize those chambers, like a conductor getting everyone back in tune.
So it fine-tunes those heartbeats, and you're saying this can make a real difference for people.
Absolutely. For those with advanced heart failure, especially those with a condition called left bundle branch block, CRT can be life-changing. Trials like Companion and CARE-HF have shown it can significantly reduce both the risk of death and repeat hospitalizations.
Wow, that's huge. It's amazing how far, medical technology has come. Are there other device therapies sort of showing promise right now?
Yeah, there's a lot of buzz around hemodynamic monitoring. which uses these implanted sensors to kind of keep tabs on the pressures inside the heart and lungs. It's like having an internal alert system, letting doctors know if things are trending in the wrong direction before a crisis even hits.
So it's all about early detection. What does the research say about its effectiveness?
Well, the Champion trial, that showed that it could help reduce those dreaded heart failure hospitalizations. However, as with many things in medicine, it's not a slam dunk. Another trial, Guide EHF, didn't find the same benefit.
The classic mixed results scenario. Sounds like more research is needed to really figure out who would benefit most from this type of monitoring.
Precisely. It's about finding the right tool for the right person. Now, there are also some cutting-edge device therapies on the horizon, like transcatheter mitral and tricuspid valve repair, or TEER for short. These procedures can actually repair leaky heart valves, which can contribute to heart failure symptoms.
So it's like fixing the plumbing of the heart. Are these procedures readily available, or are we talking experimental stuff here?
They're gaining traction, but
Yeah.
you're right, we still need more data to fully understand their long-term benefits and risks. So, they offer a lot of hope. But it's important to be cautious and discuss these options carefully with your doctor.
Right. Weighing those risks and benefits as always. Okay, so we've talked devices, but let's shift gears a bit here. What about good old-fashioned cardiac rehab? Isn't that mostly for people who've had a heart attack?
That's a common misconception. Cardiac rehab is incredibly beneficial for people with heart failure, too. Regardless of whether they've had a heart attack, it's all about strengthening the heart and improving overall health.
So what does cardiac rehab look like for someone with heart failure? Is it super intense?
Not at all. It's a personalized program that combines exercise, education, and support, tailored to each person's needs and abilities. The goal is to help people gain strength, reduce their symptoms, and improve their quality of life.
So it's about empowering people to take an active role in managing their condition, which is always a good thing. Is there research to support this?
Absolutely. The REHAB-HF trial, for example, found that a tailored cardiac rehab program significantly improved physical function, exercise capacity, and quality of life in older adults hospitalized with heart failure.
Yeah, that's fantastic. It sounds like this should be a standard part of care for all heart failure patients. It's all about that holistic approach, right?
Exactly. It's not just about treating the heart, it's about treating the whole person. And speaking of treating the whole person, there's another essential aspect of care we need to discuss, and that's palliative care.
I'm glad you brought that up. Palliative care often gets kind of a bad rap, like it's only for people who are, giving up. But we know that's not true at all.
Yeah, you're right. There's a huge misconception that palliative care equals end-of-life care. In reality, it's about so much more than that. It's about improving quality of life for anyone with a serious illness at any stage.
So for those listening who might be, unfamiliar, can you, demystify palliative care for us? What does it actually involve?
Sure, it's about focusing on what matters most to the individual. That could mean managing pain and other symptoms, providing emotional and spiritual support, or helping someone navigate, complex medical decisions. It's about ensuring the best possible quality of life for as long as possible.
It's about living well, even with a serious illness. And I imagine that can be incredibly powerful for both the patient and their loved ones.
Absolutely, and the research backs this up. One study found that involving palliative care early on was actually associated with lower in-hospital death rates for people with heart failure.
That's a powerful statistic. So how does someone know if palliative care is right for them?
That's a conversation to have with your doctor. But generally speaking, it's worth considering for anyone with advanced heart failure, especially those experiencing severe symptoms, frequent hospitalizations, or other, complex medical needs.
It's about having options and making informed decisions. Well, we have certainly covered a lot of ground in this deep dive, haven't we?
Yeah.
From high-tech devices to lifestyle changes and the importance of palliative care. It's clear that, managing heart failure is about more than just medication. What are your final takeaways for our listeners today?
I think the biggest message is one of hope and empowerment. While heart failure is a serious condition, we now have so many tools to manage it effectively. The key is to stay informed, be proactive in your care, and remember that you're not alone. There's a whole team of healthcare professionals and resources available to support you on your journey.
Couldn't have said it better myself. Knowledge is power. And by arming yourself with the latest research and having those open, honest conversations with your doctor, you can face this condition head on and live a full and meaningful life. And remember, folks, don't be afraid to ask questions. This review that we discussed today is packed with specific studies and strategies that you can bring up with your healthcare team. Advocating for yourself is key.
Absolutely. Your voice matters. And by working together with your doctors, you can create a care plan that truly meets your individual needs and goals.
That's a perfect note to end on. Thanks for joining us for this deep dive into the latest advancements in heart failure care. Until next time, take care of yourselves and keep those hearts healthy.